Dr. Budoff, what is basilar thumb arthritis?
The base of the thumb joint is right here. It's the most important joint in the entire thumb. It's used with pinching and gripping. If you take two chicken bones and you rip them apart, that white, glistening, shiny, slippery surface is cartilage. It's 100 times more slippery than ice on ice. We can't manufacture anything even close to it. If you took sandpaper and you rubbed that off, got down to bone on bone, that's arthritis, due to wear and tear, often with a genetic component. So, base of the thumb arthritis hurts right about here, worse with gripping and pinching. It can make it just difficult to use the hand and create a lot of pain.
How is basilar thumb arthritis diagnosed?
Hopefully you see a fellowship trained hand surgeon. He'll talk to you and then examine the hand. Basically, if you're tender about here and he stresses the joint and it reproduces your pain, that's a diagnosis. We take x-rays to confirm that. It's a pretty straightforward diagnosis.
What happens if you don't treat basilar thumb arthritis?
If you don't treat it, you got what you got. Often arthritis progresses and gets worse over time. And again, hurts with pinching and gripping and use of the hand. It makes it difficult to do things.
How is basilar thumb arthritis treated?
First thing we try is activity modification. We always start slow. If you pinch due to leverage, 1 pound of pinch here leads to 12 pounds of force on that joint. So if it's arthritic, it can really hurt. So you want to do everything big. You want to pinch and grip big. I tell my patients big, thick pens with rubber on them, not the small metal ones. Opening up jars of KitchenAid devices, they make it bigger, they're rubber, it's easier to grip them. It helps out. My website, rearmyourselftexas.com, has a link to T-handles that fit over keys, makes it easier to turn them. If you're using tools, wrap electrical tape around them. If you're playing golf, use fat boy grips. I also like splints. I like the rubbery, soft neoprene ones because you can do things with them. They're user-friendly. The metal ones, they restrict motion too much. They restrict use, and people often don't wear them. Obviously, if you don't wear them, they're not going to help. And I often start also with a steroid injection, try to calm things down. That's not operative management. If that doesn't work, you can live with it or you can have it addressed surgically. The procedure I like is the LRTI. It's the quote-unquote gold standard, if there is such a thing. It's been around since the early 80s. Studies have shown it keeps on improving with strength and function over time. Basically, again, the problem is the thumb is resting on this arthritic bone of the wrist called the trapezium. So we take out that bone, make a cut here, cut a tendon, bring it through. You don't need it, it's okay. We do it to baseball players all the time. They don't miss it. Basically, we put it here, so instead of the thumb resting on a hard arthritic bone, rests on a soft little tendon pillow. Put a little harpoon anchor in there. It's got stitches, holds it together. You're gonna splint full time for a week and then removable splint for 5 weeks. Go to therapy, do homework, get your motion back. Surgery is not bad, but there's no heavy gripping, lifting, or pinching for 3 to 4 months, which is the toughest part of the surgery. It works very well, it's commonly done, and people usually get pain-free and regain function and are very satisfied.
Thank you for your time today, Dr. Budoff.
Thank you.